Good morning, students. Welcome in this class. This is class 7th, subject Social Science. We are studying about Civics Chapter 2, Role of Government in Health. It is the second lecture of this chapter, and in today's lectures, the topics which are to be discussed are like these. First is types of health services, and in which we will discuss about two types of health services, public health services and private health services. Second topic, healthcare and equality. Third, the Kerala experience. This is one case study which is given in your book, means in your NCERT textbook. And last topic, the COSTA RICAN approach. This is a country that's situated or located in South America. So let's we start today's discussion. Yes, in today's discussion, first we will recapitulate our previous topics in brief. Yes, in yesterday topic, we discussed about meaning or definition of health. Yes, friends, if means in simple word, if we say that health means our ability to remain free of illness and injuries. But in broader sense, means health means something more than this definition. Actually, the health is a vital aspect because healthy people can prove themselves resourceful. Apart from disease, we need to think of other factors such as clean drinking water, pollution-free surroundings, because these factors affect our health a lot. Okay, means to remain healthy, we need clean drinking water, pollution-free environment, enough amount of nutritious food. Okay, and to remain healthy, we should that free from mental stress also. Means a life with stress will lead us to illness. So we need to be without mental stress or strain. So good health includes both sound mind and sound body. Means a healthy person must be physically or mentally both side fit. So understood? Yes. Now we will discuss about two types of health services, public health services and private health services. Yes, students, actually public health services are the basic facilities which are given to us by our government. So when our government provides these services to us, so for that where it get money. So where our government gets money to provide these basic facilities to us. So beta for that we pay taxes to the government. Okay, now we will discuss about it ki why we pay taxes to the government. So as I told that our government provides us different basic facilities like electricity, water supply, public transport, public hospitals, okay, and employments also. So for that, means we have to pay some money in the form of taxes to the government, okay, to run the system or to provide these services to us. Understood? And the government use this money, means the taxes which we pay to the government use this money of the taxes for providing many basic facilities or services like defense, police, judicial system, highways. Means beta this type of some facilities are there which we can't afford or arrange for us ourselves. Okay, means it is impossible to that arrange all these type of facilities for us ourselves. So these types of facilities are provided by the government. Means this is the duty of the government to provide all basic facilities to its citizens. And if we talk about a democratic country, means in a democratic country, it is the expectations of the people that government work for their welfare. Means through the provision of education, health, employment. Okay, and public services is a chain of health. It is a chain of health centers and hospitals run by the government. And if we are specially actually means we are talking about the health services, public health services. Okay, so public health services is a chain of health centers and hospitals and run by the government. Means the health centers and the hospitals which are run by our government are known as public health services. Okay, and as we see that all these health services, public health services means hospitals, public hospitals are found in both rural areas and in cities also. But in rural areas, these hospitals are found on small scale. Okay, and there is a less number of doctors, less staff is there, and less facilities are available there. And this type of hospitals are known as small hospitals, which are found in rural areas are known as PHC, means primary health centers. And if we talk about the district level, so in district means big hospitals are found, district hospitals are found, okay, and in which there is the more staff, more trained doctor, more facilities are available there. So students, public health services, or the why they are known as public. Actually, the public service is called public for many reasons. Like means first, these facilities are for all the citizens of the country. Means these services are provided to all the people of the country without any discrimination. Okay, like in private hospitals, these private services, health services are available for only those people who can afford. Means those who are rich and can afford these services, only those people can go there. But in public health services, means these are for all the citizens of the country, and the resources needed to run these services either free or at low cost. Yes, beta. The main advantages of these public health services means that they are given to the public or to the people at at very low cost or free of cost. Okay, but for that means if we visit to a private hospital, for that we have to pay a large fee to doctor. Understood? But in public hospital, that the facilities which are given, they are free of cost, and or otherwise we have to pay a very small amount for this. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, and jaundice. Okay, beta. Means this is the another important function of public, that is to take action to prevent spread of such type of diseases. This has to be organized by our government with the participations of peoples. Okay, I means otherwise it will not effective. And here I can give an example, like when taking up a campaign to see that mosquitoes do not breed in the water cooler, rooftop. So this has to be done for all houses in the areas. Understood, beta? Yes. Now, public health services. Now we will talk about these public health services in our constitution. In our constitution, what provision is given about public health services? Okay. So, beta, according to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. Okay, so actually in our constitution it is mentioned that it is the primary duty of a government to provide all the basic facilities or to ensure the welfare of the peoples, okay, to its, or means it is the duty of the government to provide all basic facilities to its citizen, and the government must safeguard the right to life. Okay, means right to life, that every person has the right to get all basic facilities to lead a healthy life, like that clean drinking water or pollution free environment. Understood, beta? Yes. So actually, in our previous topic, we had studied about a story of Hakim Sheikh. Okay, when he met an accident and the government hospitals denied to admit him. Okay, so for that he filed a case. So as we have studied that in our constitution, there is a provision that it is the duty of the government to ensure the welfare of the people. So means the government hospital cannot deny to admit any people. But it happened with Hakim Sheikh. Okay, means when he met with accident, then the government hospital denied to admit him due to or that lack that less facilities of bed or doctors. This is there. So for that he filed a case. So means in this case the court said that it was the duty of the government to provide the necessary health services including treatment in emergency situations. Hospitals and medical staff must fulfill their duty of providing this necessary treatment. So when Hakim Sheikh was denied treatment at various government hospitals, so the court asked the state government to give him the money that he had spent on his treatment. So, means in this way we can understand that in a democratic country that it is the duty of the government to provide all basic facilities or health facilities to its citizens. Now the second one is that is the private health services. Yes friends, actually in India there is a wide range of private health facilities. Okay, a large number of doctors run their own private hospitals or clinics. Like in rural areas that they are known as RMPS, means registered medical that is practitioners. Okay, and in urban areas have a large number of doctors and many of them providing specialized services. So actually beta in these private hospitals that there is more facilities are available and more hygiene also there. Trained staff are also there. Means if we compare that public health services to the private health services, means in private health services or you can see the better health services are found in private centers. Okay, yes, now the health cares and equality. Okay, friends. So, but before starting this topic, that healthcare and equality, first we will compare public health services with the private health services. Yes, friends. So, what is the main difference between public health services or private health services? The first main reason like public health services are run by the government and private health services are run or managed by the individuals. Second, public health services provide healthcare facilities either free or means at a low cost. Okay, and means even the poor people can seek or take treatment easily. Whether or while private health services are concerned mainly for profit, means they usually prescribe expensive medicines, and public health services are found both in rural and urban areas, but private health services are concentrated in urban areas, means private health services are found mainly in the urban areas. Understood beta? Yes. Now healthcare and equality. Is adequate healthcare available to all? Means all these healthcare facilities are given equally to all. Means all people can get the treatment of illness. No. Yes beta. Means we can say without any doubt that adequate health care center is not available to all in our country. Actually, in public health care centers, facilities are not available. Okay, and they are less in number also, and all the best facilities are available in private hospitals. Okay, but these private hospitals facilities are not, means they are not for all people. Actually the poor people cannot afford the facilities of private health centers. Understood? So means in our country private services are increasing. Means there is a large number of private hospitals are found in India, and in our previous topic we discussed that is a data of the number of hospitals and doctors which are found in India. Okay, means there is a large number of private services available in India, but mainly these private services are concentrated or found in the cities. Okay, and the cost of services is high and medicines are also expensive. Okay, beta. So means private services are increasing, but public services are not. So as a result, private services are mainly available to people, and but these services are found or concentrated in the urban areas, and they are expensive also. Poor people hardly afford them whenever there is illness in the family. Okay, and for that they either borrow money or sell some of their that part of their land. Okay, so the medical expenses causes great hardship for the poor people. Means the best health services are not available to the poor people. Poor people cannot afford all these facilities. So here I have shown you some data, like in India only 20% of the population can afford all medicines, and 40% of the people have to borrow money at the time of illness, and women are not taken to doctor in prompt. Understood, beta? So these data show that means all healthcare facilities, adequate health facilities are not available to all. Okay, means only rich people can afford all the that healthcare facilities, and means poor people can't afford. They can't afford the that expensive medicines. They can't afford the that expensive treatment of the private health centers, and 40% of the people means they have to borrow money at the time of illness. Means poor people hardly afford this expensive health facilities whenever there is illness in the family. So for that they either borrow money or sell some part of their land also. So these medical expenses cause great hardship for the poor people, and they avoid to go to a doctor unless it is very urgent. Okay. Why? Due to their poorness. And it has also been found, beta, that women are not taken to a doctor in a prompt manner. Like their health concerns are easily ignored. Many tribal areas are also there, that where they have a few health centers and they do not run properly. So in this way we can say that in India, whether the healthcare centers are there, all facilities are available, okay, uh, but these facilities are not equally for all the people. Means these facilities are for only rich people. Means rich people can only afford these best health services. Okay, yes. Now, one case study is given about the Kerala. I think everybody knows about the Kerala state. It is in India, southern part of India. Okay, so actually in 1996, the Kerala government decided to give 40% of the state budget to Panchayat. So means Kerala government made some major changes in the state in 1996. Actually, it gave about 40% of the entire state budget money to the panchayat so that they could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development and education. So in this way, water supply schemes were checked, the working of schools and Anganwadis were ensured, and some specific problems of the village were taken up. Health centers were also improved. So, but means they made a great efforts to provide all basic health facilities to the people of Kerala. Okay, means the state government of Kerala that it decided to give 40% of the state budgets to panchayat to provide all basic facilities to the people. Okay, and for that village was given rights to do planning for water, food, okay, and women's developments and educations. Means this money was spent to provide the clean drinking water, enough amount of food, and spends on the some development program for women also and on educations also. But in spite of all these efforts, some problems such as shortage of medicines, insufficient hospital beds, means not enough doctor, means these types of problems also still exist and they are needed to be solved. Means we should encourage that efforts of the Kerala government, Kerala state government, which it made for its people. Okay. Now, the next is given about the Costa Rican approach. Actually, Costa Rican approach, what is that? Costa Rica considered to be one of the healthiest countries in the world. Okay, means that country Costa Rica is the means situated in the South America, and it is considered that one of the healthiest countries in South America. And the Costa Rican government also means that decided to improve the health condition of its people. And for what the government of that means Costa Rican did, actually the Costa Rican government gave much importance to the health of its citizens, and it took an important decision and decided not to have an army. Yes, in this way it saved money and began to spend this money on health, education and other basic needs of the people. Yes, the Costa Rican government believes that a country has to be healthy for its development and pays a sincere attention to the health of its people. So that was the one main reason for the success of the system is the large involvement of mid-level workers who effectively extend health programs to remote areas. So therefore they are much cheaper than the doctors. So it provides all basic services and amenities to all the people of the country, like it provides clean drinking water, sanitation, nutritious food and housing. Healthcare education has been made an important part of the education, and at all levels students are provided knowledge about health. That was also a great efforts, okay, of the Costa Rican government. Understood, beta? Yes. So in this way our today's lecture or topic is completed. Now we will, that means I will assign you some question answer to solve related to this chapter. First is differentiate between public health services and private health services. Second, what are the negative aspects of healthcare in India? About this topic, we had a discussion in our previous lecture. Write down the main features of public health system. How can we say that adequate healthcare is not available to all? So this is your homework. The answer of this question you have to write in your fair notebook. And if you face any problems, okay, in the answer or solution of these questions, so for that we will discuss the answer of this question in our next lecture. So you can take help from there. Now the homework solution. First question, what do people in a country expect the government from the government? Yes, people in a democratic country expect the government to work for their welfare. Understood? Yes. Where do most doctors prefer to settle? Yes, most of the doctors prefer to settle in urban area. Why? Because that in urban areas more facilities related to health, educations or like basic facilities, water, transport are available easily. That's why. What problems do rural people face whenever they come in the grip of an illness? Yes, they have to travel long distances to reach to the doctor. Yes, beta, during the discussion I told you that most of the private hospitals are concentrated to the urban areas or city, and most of the doctors prefer to settle or live in the urban areas. So that's why in rural areas there is a you can say less number of hospitals or health services are available. Okay, and so means to get treatment or for the treatment, the village people have to go in the cities. Okay, and for that they have to travel long distances to reach the doctor. Now, define health in broader perspectives. Yes, friends, in simple word or meaning, if we say that health is the ability of person to remain free of injuries and illness. Means the common definition of health is the ability of person to remain free of injuries and illness. But health is not only about disease, means in broader sense that health is more than this definition. Okay, It is something more than that. Apart from disease, we need to think of other factors such as safe drinking water, clean surroundings, and etc. Means we should pay attention on the other factors which affects our health, like we need clean drinking water, okay, and to remain healthy we need a clean or pollution free environment, enough or nutritious food. So means all these factors also affect our health in various way, and we should think about it. If people fail to get these basic amenities of life, they will fall ill. So being active and in good spirits are also essential part of our life. Means to remain healthy, we should be active. Means we should do some exercise also. So understood about it? Means we should take care all the aspects which affect our health. Clean drinking water, pollution free environment, enough amount of nutritious foods, and some exercise. And we should that remain, or means we need to be without mental stress also. Means good health includes both sound mind and sound body. Means we should be healthy physically also and mentally also. Understood? Yes, friends. So in this way, our today's lecture is completed. Tomorrow we will meet again with the summary of the lecture. Understood? Yes, friends. But I before end of the lecture, I want to say something you. Actually, the homework which I am receiving on my email ID. So in which I have found that many students are there, those who are not writing their homework in or me sending their homework in proper format. Okay, beta. So in which I am facing problems. Some students are there, those who are sending homework that in which there is no class is not mentioned, no student's name is also not there. So miss, when you send your homework, then send it with proper format. Like first write your name, then your class and roll number, or miss class section and roll number and father names. So understood, friends? Okay. Thank you.